What is conductive hearing loss and how is it treated? Imagine trying to listen to your favorite song but feeling like the sound is muffled or distant. That's often what people with conductive hearing loss experience. It happens when sound waves can't travel properly through the outer or middle ear to reach the inner ear where hearing actually happens. Even if the inner ear and the nerves are perfectly healthy, this blockage prevents sound from getting through. Because of this, sounds may seem muffled, quieter, or harder to hear, especially softer noises or speech in noisy environments. Some people also feel a fullness or pressure in their ear, and sometimes there may be pain or drainage if an infection is involved. Conductive hearing loss can be caused by many different issues affecting the outer or middle ear. For example, earwax buildup is a common cause. When too much wax blocks the ear canal, it can prevent sound from passing through. Foreign objects lodged in the ear canal, infections like swimmer's ear, or growths such as bony exostoses can also cause problems. Congenital conditions like microtia or oral atresia, where parts of the outer ear are malformed or absent, may lead to hearing difficulties from birth. Tumors in the ear canal are less common but can also block sound transmission. Problems in the middle ear are equally important. Infections like otitis media or fluid buildup from eustachian tube dysfunction can dampen sound transmission. A perforated eardrum, which can happen after injury or infection, allows sound to escape and reduces hearing. Damage or fixation of the tiny bones in the middle ear, called ossicles, can interfere with how vibrations are passed along. Conditions like otosclerosis involve abnormal bone growth that stiffens these bones, making it harder for sound to travel. Cholesteatomas, which are destructive skin growths, can also damage the middle ear structures. Symptoms of conductive hearing loss often include difficulty hearing soft sounds, muffled hearing of louder noises, a feeling of fullness or pressure in the ear, and sometimes ear pain or drainage. Dizziness can occur if the inner ear is affected, but it is less common. The good news is that many cases of conductive hearing loss can be treated effectively. If the cause is earwax or a foreign object, simple removal usually restores hearing. For infections, antibiotics or anti-inflammatory medications can clear up the problem. When structural issues are involved, surgical procedures may be needed. For example, repairing a perforated eardrum, removing growths like cholesteatomas, or fixing damaged bones can restore normal sound conduction. In cases where surgery isn't an option or doesn't fully help, hearing aids or bone conduction devices can be used to amplify sound or bypass the problem altogether. Most conductive hearing loss is temporary and reversible when treated properly. This is different from sensorineural hearing loss, which involves damage to the inner ear or auditory nerve and is usually permanent. Early diagnosis is especially important in children to prevent delays in speech and language development. If you notice signs like muffled hearing, ear fullness, or discomfort, it is best to see an ear, nose, and throat specialist or an audiologist. They can perform examinations and hearing tests to find the cause and recommend the most appropriate treatment. Always remember that personalized medical advice from a healthcare professional is essential for proper care and recovery.